Welcome to this comprehensive health policy briefing on hantavirus. We begin with a clinical overview to better understand hantavirus as a zoonotic virus and the associated human health risks. Hantaviruses are transmitted primarily by rodents. The most common route of human infection, ice inhalation of aerosolized rodent droppings, urine or saliva. Human-to-human transmission is extremely limited, only documented for the Andes virus in South America. Hantavirus pulmonary syndrome, or HPS, is predominantly found in the Americas. The sin nombre virus is the primary cause in North America. HPS is highly fatal, with mortality rates reaching 50%. Hemorrhagic fever with renal syndrome, or HFRS, is common in Europe and Asia. Key strains include Hantan, Pumala, and Dobrava Belgrade viruses. HFRS is characterized by intense headache and varying degrees of acute kidney injury. Its mortality rate is lower than HPS, but morbidity is high. HPS, found in the Americas, has a high mortality rate of 35% to 50% and targets the lungs and heart. HFRS, found in Europe and Asia, has a variable mortality rate of 1% to 15% and targets the kidneys and vascular system. Hosts also vary between the two regions. Environmental trends show that shifting precipitation patterns and mild winters are expanding rodent habitats. This leads to rodent booms, increasing human exposure risks in previously low incidence regions like the Pacific Northwest and southern Chile. Research advancements in 2025 include Phase 2 clinical trials for DNA vaccines targeting the Andes and sin nombre strains. New antiviral screens are identifying molecules that could offer the first specific treatment for HPS. Monoclonal antibody therapies are also being tested for post-exposure prophylaxis. The hantavirus incubation period is 1 to 8 weeks. Diagnostic challenges include non-specific early symptoms that mimic influenza. Key lab markers are low platelets and hemo concentration. Confirmation requires RT-PCR or serological testing. Prevention focuses on rodent proofing by sealing gaps larger than 6 millimeters. Safe cleaning involves using a 10% bleach solution and damp cleaning methods, never sweeping or vacuuming. Always wear gloves and high-grade N95 masks when cleaning heavily infested areas. Despite being relatively uncommon, the high fatality rate of hantavirus and the impact of climate change necessitate constant public health surveillance. Early supportive care is currently the only lifesaver, and increasing public awareness is critical to reducing future outbreaks.